Today marks World Toilet Day. The day is aimed at highlighting the importance of providing adequate sanitation as entrenched in the United Nations Sustainable Development Goal 6, which calls for sanitation and water for all by 2030. Experts have noted that next generation sanitation could potentially be a forward-looking approach for the development of sanitation in South Africa. To discuss this further, we are now joined by Water Research Commission CEO, Dr. Jennifer Molwantwa. Doc, thank you very much for availing yourself this morning. How should we understand South Africa's sanitation landscape?
Good morning, and good morning to, thank you very much for the opportunity. We have got a landscape of sanitation in South Africa, which we can say it is quite unequal. Basically, where you come from seems to be determining what kind of sanitation you have. And this is obviously attributed to the challenges of the past in terms of the disadvantaged and marginalized people, and also the current backlog, which is also contributed to the growing population, the unserved informal settlements, and still some of the rural areas. And therefore, you have got a situation where in the big cities and some urban areas, you have got sanitation, which is flushing, which is sewered, which feels good, which is a privilege that most of us have had. But there are people still in our country who do not have sanitation. They are around 15% of the population, and which differs in the different provinces. In other rural areas as well, you are finding that people are having the minimum standards, which would be your VIP toilets. There are still people that are also using long drop toilets. So it's really not balanced, it's not equitable, it's not the same for everyone, particularly the experience that one has when you have to relieve yourself.
Doc, did we hear you properly? You said 15% of the population does not have access to proper sanitation?
I'm saying that on average you could talk to about 15%, but it differs from different provinces. There are other provinces where you have got more than 85% serviced in terms of access to sanitation, but there are others that are below 85%.
Thank you for the clarity. Then in comes the next generation, or the concept of next generation sanitation. What does that mean, and how could it possibly help to plug the gap?
We are here referring to it at the Water Research Commission as the Tesla of toilets. And what we mean by this is that we will have new generation toilets. It's something that you can, it's an appliance model of sanitation system. That can buy, as you would buy your microwave, as you would buy your cell phone, and you would decide which quality, which high-end or low-end, what you would like to have. But in essence, you can have a sanitation system, which is a toilet box. And what we mean by that is that you will have a toilet in your household where everybody can be able to experience the feel and touch of a flushing toilet anywhere, irrespective of whether there is drinking water, whether or not it is, a sewer infrastructure, but there is a limited and little bit of water that you would input. It is also recycled within the system, and you do not have to add additional water. But also the waste and the solids that are separated from the liquid that is reused is actually disinfected. It is put under pressure, and it is compacted to a point where you are able to just dispose of it everywhere. This would deal with the two challenges, the availability of water to carry waste, and hopefully to also change the kind of waste where we're using potable water to convey waste in South Africa. But it will also deal with the issue of landfill sites and wastewater treatment works that are not very functional. Most of them are overloaded. And this prototype was showcased at KwaZulu-Natal in eThekwini, where there was a collaboration between the Water Research Commission, the University of KwaZulu-Natal, the Bill and Melinda Gates Foundation, as well as funding from the Department of Science and Innovation, where a number of options were looked at, And basically we are saying if you're looking at high density areas, you could actually treat the waste on site, separating the liquids and the solids, reusing the liquid for the treatment system, and then having the minimal waste that you need to dispose, solid waste.
How much of a collaboration is this going to be between the impacted communities and government, especially when we speak of rollout now?
So what we also pride ourselves at the Water Research Commission and with our partners is that in this case, the innovation was not only looked at from a scientific point of view, from a technology and innovation point of view, but part of the research entailed testing it within communities where we were provided with feedback in terms of look, the feel, and what the experiences of the communities were. And this is how we got to this G2RT toilet, which is the new generation toilet. And how this then, what we have been able to get to is to understand that this is something that is acceptable to the community, obviously given the pilot site that we had. And where are we? As I said, we are at least about 5 years away from the rollout of this technology in terms of the work, further work that is being done by Georgia Tech, funded by the Bill Gates Foundation, Bill and Melinda Gates Foundation. And in terms of South Africa, when we're talking about rollout, one of the critical issues that we need to be looking at is the policy position around sanitation. The current norms and standards are below what we view this technology as will be providing. Therefore, as we update the norms and standards, we will then be looking at the higher level in terms of the ISO, but we must also not think it will be just a rollout for the sake of it. We need to be looking at the backlog. We need to be looking at areas which mostly would benefit from the utilization of this sanitation technology. In terms of government policy, we also have to note that, for example, looking at the Department of Human Settlements, Department of Basic Education, or Department of Health, if they were to want to uptake this technology and utilize it, it would mean that our procurement policies would need to be changed, where currently we're focusing on you have to have an open and competitive technology or whatever solution you want to provide. Now, when we're talking about innovation, we need to acknowledge that that is one, something that is specific, something that is different, something that is type of investment to get to that innovative technology. And therefore, we are engaging with National Treasury to try and see that we can start including innovation on new technology. So you need to have a competitive bid, or unless you are bringing it new innovation technology. For us at the Water Research Commission, this is so important because the water users are paying for the water research levy, and therefore the return on investment would be that the South African population should be able to benefit from this innovation and technology that we are participating in the development thereof. Thank you.
Doc, before we let you go, you mentioned that water users are paying for the water research levy. Please tell us more about that.
So the Water Research Commission is established in terms of Act of Parliament, Water Research Act of 1971, which is currently being undergoing an amendment to fit into the new model. As part of the bulk water users, which we'll be talking about in particular the water board, they would be paying a part of the payment from the water sales. Part of that payment goes towards what's called the water research levy. And when we're looking at the water research levy, currently we're looking at about 7 cents per 1,000 liters. So it's similar to what we call the fuel levy, for every liter that you put in, there is part of a levy in there. And so is the Water Research Commission funded in that model to ensure that as we are dealing with issues of climate change, these issues of water security, we are able as a country to take the best minds to research and look into new solutions, not only for the current challenges, but that will take us into the future to ensure that we have got a water, food, and food secure country.
Given that South Africa is a water-scarce country and we are seeing some worrying reports, especially when it comes to the quality of water, perhaps, so for instance, in the country, how then do we assess, please help us understand if they're even related, the work of the water research agents or people?
Research Commission has got a number of research areas of focus, and water quality is one of them. So the technologies that we are developing, the fundamental research that we are developing, for example, looking at chemicals of emerging concerns, looking at resistance, for example, resistance to chemicals, resistance to medicines or pharmaceuticals. We are involved in that kind of research. And that research then informs how we are able to improve on water quality. Looking at specifically the sanitation solutions that we have worked on, and the new generation toilet is just but one of them. There are a number of others, for example, ones that are able to separate the liquid and the solid and be able to use that solid for fertilizer or use that solid as biochar, for energy. Those are going to contribute positively towards improving water quality, because we know that in light of the Green Drop report that was recently released by the minister, we know that most of our wastewater treatment works are not able to deal with the load, treat, and discharging substandard water into our resources. And therefore, if we can be able to reduce the load that goes into these systems, able to reduce the volumes that go into this system, we are able to provide our water resource with a potential time to actually clean themselves, utilizing water services in terms of the ecosystem infrastructure that we have, so that we can have improved water quality. So we believe that this is a step in the right move. We need to be able to get to a position where we are able to take up this kind of research as the government and be able to implement these in the different. So we need an integrated approach across the different spheres of government and across the different partners, the different departments, to be able to benefit from this investment that South Africans are making towards water and sanitation research.
Doc, thank you very much for availing yourself this morning and talking us through that. Dr. Jennifer Molwantwa is the CEO of the Water Research Commission.